Dr. Rice, thank you so much for taking time out of your day to be with us and help give us the opportunity to tour Novant Health Gastroenterology Brunswick.
Sure. Glad to be here.
Well, before we get started, there may be some viewers. I know you've been on our show before, but there may be some viewers out there who haven't met you or haven't seen the show. So tell me a little bit about yourself.
So I'm Doug Rice. I'm one of the newer additions to the practice. I came down here in around the end of October 2017. Moved down from Indianapolis. My wife and I moved down. I just to give you a little bit of my background. I was in a large practice there in Indianapolis, and before joining here, the hospital employee group. Before that, I had done the majority of my training. I guess I should back up. Let me go back to medical school. I went to University of Kentucky. We'll get started there. University of Kentucky College of Medicine, graduated from there, and I did my intern year at Ohio State, and then went back to University of Kentucky, finished up my internal medicine training there, stayed on there for a chief year, and then did my gastroenterology fellowship at University of Kentucky as well.
Right. Well, we're glad to have you here. It's a pleasure to have you. So what can you tell me about Novant Health Gastroenterology Brunswick? That is a mouthful.
It is it's a long title.
So tell me a little bit about the practice.
So in the practice here, we treat a pretty broad spectrum of GI problems. It can be anything from a patient coming here that may need an endoscopy for something like reflux, esophagitis, ulcers, something like that, all the way to, we pretty much cover the esophagus, the stomach, the pancreas, the colon. Also, the liver is a very important component.
Right.
Hepatitis is
that's a big thing here.
It's a big thing, yes. We do a lot of hepatitis treatment here, hepatitis C, hepatitis B. So anybody that has it's basically a broad spectrum of GI illnesses can come to our practice, and it does not always involve the scope. There's a lot of medical management that's done here as well.
Yes, we just toured the endoscopy suite, but I know that you guys do a lot of other things besides just scoping. So wanted to bring them here to learn about what else you do here. So it is a wide variety of services. So it must be really convenient to you, though, to have the endoscopy center next door. I'm sure that cuts down on your time. Is that?
Yeah, that's true. It is nice because we have the clinic on this side. They're technically two different facilities, but connected by a door. Exactly. So I can come in here in the morning and be scoping in the morning next door, and then maybe come here for an afternoon of clinic patients.
But there are patients that you will still scope at the hospital. Is that correct?
That's correct. Yeah, a certain subset of patients, depending on why we're scoping them, will be done at the outpatient endoscopy center. And then there are a few factors that we look at to decide who gets scoped here at the outpatient center versus at the hospital.
And are you taking new patients?
Absolutely, yes. I am certainly taking new patients.
Wonderful. Can you tell our viewers how they might make an appointment here?
Yeah, so I think the best way, there's a couple different things. A primary care provider can refer someone here, and that happens frequently. And that's kind of an automated process within our Novant system. And also from outside of the system, primary care doctors will refer. If a patient decides that they want to see a gastroenterologist, they can self-refer as well. So I would advise a patient who they can discuss it with their primary care doctor, or they can just give our clinic a call, and we can kind of route them in the appropriate direction to what they need to do to make an appointment.
Well, you know, living in this area, there are a lot of folks who are here just part-time, and they know when their colonoscopies due. So if they choose to have it here while they're here in the area, they can just call, make an appointment with you all, and then maybe have their scope here.
Sure, and a lot of times they'll come in and maybe it's a visit for a colonoscopy and they have something else going on that they want to address as well. So that happens frequently in the office that we can address. They may have reflux disease or something else that goes along with that. We can get their screening colonoscopy taken care of and also address some of their other issues they may be having.
How many patient rooms do you have here?
Let's see, on my hallway, I guess the total number is probably...
There's a lot.
Yeah, there's
so we're
probably
going to take a look at one of those rooms.
We usually have, each physician usually has two rooms going, and we kind of alternate back and forth. But we actually have more rooms right now. We have a lot of room for expansion.
Right, we're planning for the future here.
But the hallway that I work in typically has about 5 rooms over there, but I work out of 2 of them at a time.
2 at a time, that's great. Well, thank you so much for being with us today. We appreciate you being back on the show, and we look forward to having you back at a later date.
Thanks, Jimmy.
You're welcome.